Thank you for inviting me. My name is Michael Schimmel, and I'm the head of the Neonatal Intensive Care Unit in Shaare Zedek Medical Center. I'm a professor in pediatrics in the Hebrew University, Jerusalem, Israel. I'm going to talk today about dilemmas which we are facing in our NICU. What is bioethics? Bioethics is an activity process. It is a shared, reflective process of examining, dealing with a variety of controversial issues in a healthcare, health science, and health policy. This is one of the definitions which you can find in the literature, and it's a modification of a definition which is in the website of Michigan State University, and I built it together with Dr. Tia Powell from Montefiore Hospital. Bioethics brings a lot of dilemmas. Does the baby have the same rights as the adult? Is there an ethical difference between the healthy newborn and the neurologically impaired newborn? Ethical values are life or the question of quality of life? Should there is financial consideration? Which treatment can be withheld and which one or be withdrawn? Who has the baby's autonomy? The parents, the medical team, hospital ethics committee? Who is in charge? So we see that there are many questions, but definitely we know today that we are able to save babies. Should we do this for every baby? From technical point of view, we can do it, but ethically, are we obliged to do it? Who is the baby which we are going to declare as a palliative care baby? This is a street in Jerusalem. You can see we have Christians, we have Jews, we have Muslims, we have everybody together. And we have to deal with ethical question with all three of the monotheist religions. Every baby deserves a unique and has the need for individual approach. But as our society is based a lot of religious, and religious play a lot of importance in the addition to the personal communication with the parents, we have to deal with all whom we are going to declare palliative care. So to answer this question, what we did, we built up 4 theoretical cases and we sent them to numerous clergymen, Christian, Muslims, and Jews. And the question was, in the case which is brought in front of you, what would your religious or ethical approach will be? Case number 1 is, we are talking about a 22-week baby which was born to a young couple after fertility therapy. The baby is crying, has moderate respiratory effort, normal heart rate. In the hospital, the baby is born, and in the region around, nobody was saved at the age of 24 weeks. The Christian answer was, if you are sure with the date and rate of survival rate is 0, you don't have to do anything and just give comfort care. The Islam told me do full medical care, and the reason is from the conception where past more than 120 days, the baby or the fetus deserve full therapy. According to Judaism, you are not sure about the date. The only time you can be sure about the date is when you're talking about IVF. So if the IVF, you can give just comfort care. If it's not IVF, go do a full therapy and then discuss with the family later on according to how the baby is getting better or not. The second case is baby with neonatal encephalopathy, post-placental abruption at term. The baby is ventilated, treated with hypothermia, get anticonvulsant medication due to the prolonged seizures. MRI revealed extensive brain damage. Stable hemodynamically is right now. He needs tracheostomy, he needs gastrostomy just for the palliative care. The Christian gave me an answer. The procedure may be done according to the family request. And the reason is that as the baby is not brain dead, both procedure may be performed. The ability to love God and the ability to be loved by God is more important than just life. The Islam, there is no need for invasive procedure, and the reason is the neurodevelopment as nothing is not in our hands, it's in God's hands. And as we are talking about non-life-saving procedure, it's only according to the request of the family to do or not to do it. According to the Judaism, to the rabbis which answered me, was that definitely the procedure should be done, and the reason is just to help the palliative care. The third case was the 27-week baby. On the third day of life, there is deterioration. Head ultrasound showed extensive bilateral grade 4 IVH. And according to the physician who is taking care of the baby, the survival is doubtful. But if it occurs, significant neurodevelopment impairment is expected. Either if there will be a further deterioration, a cardiac arrest, should CPR be done, yes or no? According to the Christian, no need for CPR. And according to the Islam, CPR should be performed, and it's none of in our hand the chance of neurodevelopment impairment outcome. According to Judaism, no need for CPR because the baby was dead. You don't have to bring him back to life. The last case is the term baby born with trisomy 21. Diagnosis is with hypoplastic left ventricle. According to the expected, the baby will need at least 3 major operations during the first year of life. Survival rate in normal babies not with trisomy 21 is 60 to 70% in the first year of life. I know that in the States the survival rate is higher, 85%, but this is the question which was brought to the clergymen. According to the Christian and the Muslims, as the operation is essential, it should be performed. According to Judaism, the surgery should be performed only if it's not an experimental surgery. Experimental surgery means that the success rate is above 51%. So our message, take-home message is, in order to provide the optimal therapy, we have to know very well the religious and the cultural background of the newborn and its family. And if needed, and from my point of view it's always needed, to offer the a personal discussion with the clergyman. Because when you talk to the clergyman, you can objectively bring all the medical data so he can make with the family a very well decision-making process. Thank you for all of you for your attention. Thank you.